By the year 2050, there will be more deaths due to antimicrobial resistant infections than cancer. This is one of the top health problems in the 21st century. My name is Cesar Arias. I am the Chief of Infectious Diseases at Houston Methodist. I am also the co-director of the Center for Infectious Diseases at Houston Methodist Research Institute, and I'm professor of medicine at Weill Cornell Medical College. I am the editor-in-chief of Antimicrobial Agents and Chemotherapy. I also have the honor to be the Bookout Chair for Excellence in Research at Houston Methodist Research Institute. I am working on antimicrobial resistance for more than 25 years. I wanted to understand how these fascinating changes that bacteria actually do in response to the antimicrobial agents can have enormous clinical and public health consequences. So we have performed several studies, both in the United States, and we have established some research units in South America, because this particular problem is actually much more impactful in the developing world. We have been able to describe new mechanisms of resistance to antibiotics that are actually affecting patients. In the United States, our studies show that the kind of organisms that we circulate here are highly resistant compared to other countries, like for example in Europe. And the only real difference is the vast amount of antimicrobial we use, not only in human medicine, but maybe in medicine, veterinary medicine, and other areas. Prescribing of antibiotics, particularly in this country, is something that we've been trying to regulate for years. So every time we give an antibiotic molecule, this bacteria will respond. So how we use these antibiotics becomes an important and critical issue. So regulating that practice and the education for physicians to understand that every time you use this antibiotic, you can cause a real storm in that patient. Policy can help push a new model of antibiotic development, a new model of antibiotic reimbursement. We hope that we can show that this is really impactful for patient care. Houston Methodist has created a new Center for Infectious Diseases in which antimicrobial resistance is a big part of it. Because of my focus on this research, we have been able to establish important connections both locally, nationally, and internationally to try to push the agenda of antimicrobial resistance throughout the entire globe. We're currently working on a project that is NIH funded to try to develop a test to quickly identify a very common bacteria that cause bloodstream infections like Staphylococcus aureus, and that has a particular phenotype that is related to the production of an enzyme that destroys antibiotics. We're hoping to try to demonstrate that these tests deployed in clinical laboratories around the world can help clinicians decide how to use antibiotics against these very common bacteria and potentially prevent complications and deaths caused by these organisms. So this is a very complex problem that affects many areas of healthcare and even the economy. If we don't do anything on this wave of antimicrobial resistant infection, there will be a lot of lives lost, not only in our world here, but the impact in the developing world is going to be incredible.